A biopsy is a medical procedure that involves removing a small sample of tissue from the body for examination under a microscope. Biopsies are primarily used to diagnose cancer, but they can also be used to evaluate other medical conditions, such as infections or inflammatory diseases. Biopsies can be performed on various parts of the body, including the skin, lymph nodes, organs, and bones. Types of biopsy procedures. There are several different types of biopsy procedures, each with its own advantages and disadvantages. The type of biopsy performed will depend on the suspected medical condition, the location of the tissue to be sampled, and the patient's overall health. 1. Needle biopsy. Needle biopsies involve using a thin needle to extract cells or tissue from the suspected area. Needle biopsies can be performed using different techniques, including fine needle aspiration FNA biopsy. A thin needle is inserted into the suspected area to aspirate draw out cells. FNA biopsies are minimally invasive and can be performed in a doctor's office or clinic. Core needle biopsy. A larger needle is used to remove a core of tissue from the suspected area. Core needle biopsies provide more tissue for examination than FNA biopsies, but they are more invasive and may require local anesthesia. 2. Surgical biopsy. Surgical biopsies involve removing a sample of tissue during a surgical procedure. Surgical biopsies are more invasive than needle biopsies, but they can provide a larger sample of tissue for examination. Excisional biopsy. The entire suspicious lesion or abnormality is surgically removed. Incisional biopsy. Only a portion of the suspicious lesion or abnormality is surgically removed. 3. Endoscopic biopsy. Endoscopic biopsies involve using a thin, flexible tube with a camera and light on the endoscope to visualize and collect tissue samples from the digestive tract, lungs, or other internal organs. Upper endoscopy. The endoscope is inserted through the mouth and esophagus to reach the stomach and small intestine. Colonoscopy. The endoscope is inserted through the rectum to reach the colon and large intestine. Bronchoscopy. The endoscope is inserted through the nose or mouth to reach the lungs. Preparation for a biopsy. Before undergoing a biopsy, the doctor will discuss the procedure with you and obtain your informed consent. You may be asked to fast for a period of time before the biopsy, especially if the biopsy involves the digestive tract. The doctor may also provide you with specific instructions on how to prepare for the biopsy, such as avoiding certain medications or activities. Procedure. The biopsy procedure will vary depending on the type of biopsy being performed. In general, biopsies are performed in a doctor's office, clinic, or hospital. The doctor will clean the area to be biopsied and may administer local anesthesia to numb the area. The doctor will then use the appropriate biopsy technique to collect a sample of tissue. Recovery. After the biopsy, you may experience some discomfort or pain at the biopsy site. The doctor will provide you with instructions on how to care for the biopsy site and manage any discomfort. In most cases, you will be able to resume your normal activities shortly after the biopsy. Results. The tissue sample obtained from the biopsy will be sent to a laboratory for analysis. The pathologist will examine the tissue under a microscope to determine if it contains cancerous or abnormal cells. The results of the biopsy will be sent to your doctor, who will discuss them with you and recommend further treatment or follow-up care if necessary. Risks and complications. Biopsies are generally safe procedures, but as with any medical procedure, there are some potential risks and complications. These may include bleeding, infection, pain or discomfort at the biopsy site, damage to surrounding tissues, in rare cases, complications such as nerve damage or organ perforation can occur. Conclusion. A biopsy is a valuable diagnostic tool that can help doctors identify and diagnose cancer and other medical conditions. Biopsies can be performed using various techniques, and the type of biopsy performed will depend on the suspected medical condition, the location of the tissue to be sampled, and the patient's overall health. Biopsies are generally safe procedures, but they can have some potential risks and complications. It is important to discuss the risks and benefits of a biopsy with your doctor before undergoing the procedure.